ना. So, dear student, good morning everyone. So today is second day of the foundation course. You know very well what is the foundation course. Yesterday is already started. My name is Dr. M. Itagappa, Professor and Head of the Department of Biochemistry. Today my topic is expectations of the student. What student expected either the nations or society or institutes or fears patients like that only. Okay. So now I will give some important points of this nation, society and institutions. See, your course is a noble professional course. Why? I will tell you one thing. So you are selected is the best now, because so in earlier my teacher they telling this, you select if you want to serve the nations, you choose three professions in India or nations. One is a teacher, another one is doctors, third is the soldiers, like that. So that's why I will tell you, you are a noble professions. This medical doctors, doctor is also the teachers one. See, first I will give some important points of this. What is nations? What is society? What is institutions? A nation can be defined as a group of people who are bound together into a single body. So it means who identify themselves as belong to the particular nation group, belong to group of people, they belong to the particular nations of the uh, particular nations group, like I am Indian, I am American, like that only. So you are these nations, it is a group of people who are bound together into a single bodies. So nation is different. See, suppose if all our many states together is one nations. Suppose France and German, they nation state also. This is the one. So you, what you contribute to these nations, you think about it. This is because of expectations of the student. Expectation of the student. The second point is society. A society is a group of people with common territory, interactions and cultures. See, society constructed patterns of behavior by deeming certain actions or speech are acceptable or unacceptable. These patterns of behavior within the given society are known as social norms or societies, and their norms undergo and gradually and perpetually changes, especially within the structuralist thoughts. A society may be illustrated as economic, social, industrial, cultural, infrastructural. A society can also consist of like-minded people governed by their own norms and values within a dominant or larger societies. What is important of societies? So without specific residing area means how you living in this society. So area and helping hands around life seems actually very tough. Means, so the alone is not possible to living in the areas. That's why you always belong to the one particular society. Hence, in order to live the life in the very comfortable way. So suppose the society is provide to everyone to food or shelter or clothes are essential for so particular person to live. One single effects man would be able to fulfill uh, his needs. So next, the second point. So third point, now they come to an institutions. So institution is either government or private institute. Just like our institute is a Basaveshwara Medical College is a one of the private institutions. An institution is a social structure in which, so which it means the people cooperate, either join the job or come to the study, whatever, and which influence the behavior of people and the way they live. An institution has purpose. Institutions are permanent, which means that they do not end with one person is gone. Government is an institution in the broad sense. See, so on two, three criteria are the institutions. The institution is responsible for providing various things and facilities to the students. It needs to the provide or either security or support or taking care, whatever, to the student. It needs to work for the welfare of the people or various departments, and so the bodies are called together. This is the institutions. So institutes consists of either basic or family or economy or education or religion. Especially our come to your, this is the purely educational institutions. It institutions is another name, either is establishment or foundation or institute. So medical college is an educational institutions designed to provide learnings space, learning space and learning environment for the teaching of the student under the direction of teacher. In these systems, student progress through the series of this either studying or come to the colleges also. So now, so finally what happens? So you thorough this, what is nations? Either what you give to the nations or our this how, what is the contribution to the nations and contribution to the society and contribution to the institutions like. So these are 3 points. Next, our madam is microbiology HOD. They coming to, they telling another 3 important points also.
Good morning, everyone. All young budding doctors who have joined medical course, welcome you all for the foundation course conducted by MEU, Department of MU, that is Basaveshwara Medical College and Hospital. So, the topic for today's foundation course allotted to us, myself, I want to introduce myself first. That is myself, Dr. Shubha, PS, Professor and HOD, Department of Microbiology. So already Dr. Itagappa sir is HOD of biochemistry. He spoke regarding the few points regarding the expectation of students. Okay, so that is a topic allotted to us. So it is very broad and it is we can talk so many things regarding this, but there are time constraints regarding the whatever we have to speak, and it's also vice versa. The topic expectation. So there are few points given to us. Expectation, what we expect from you, and what are the expectations from your side, from the students. Okay. So sir already spoke regarding the nation, institution, and all those things. Society. So what is society, nation, introduction? Sir gave a very good introduction of all those things. So all of you know. So all of you are going to become responsible citizens. You should know the definition of all these things. So coming to the points allotted to me, that is expectation from peers. That is, you know that peer engagement. What do you mean by what's the definition of that? I need not explain. I believe you know the definition of that. So it is a group of person belonging to the same age group. So that is the peer age group. Okay. So what are the expectations from the peers? So as I told you, so you entered a medical profession. I congratulate you once again. So you can divide this peer group into two categories. One is so medical profession. When you join, you'll have a different new peer group in the institution, and you have your classmates who are there who are non-medicals. So expectation we can divide into two aspects. One is so they already have a group of people, group of students, a group of peer group we have already you have. So that is what do they expect from you? What are the expectations they expect from you? So you have entered in medical profession, so they have a lot of respect towards you. That is so because medical profession is considered as one of the noble profession. Okay, so they looked upon you with a great respect. Okay, and so you are considered as one of the creamy layer in the society now. So all of those peer group, whatever they were friends, who are now till now who have not entered the medical profession, I'm talking about. So they have a lot of respect towards you that you have to maintain. That's the responsibility you will have in the future also. So for any of the problems, the medical related problems, anything, so they will approach you. So that time you should be able to respond them in a very good manner, so that you try to develop. So that may be the expectation from the other this thing. And also any approach for any medical problems, and they respond in a good way for the other peer group. And when you come to the medical profession, that you have now you will be coming to the classes, the offline classes will be starting from the next month. Will be coming here. You will develop a different peer group in the college institution as well. So even in the institution, so a lot of new things. Maybe some of you are day scholars, some of you are coming as a so there's residents, you're staying in the hostel. So a lot of understanding should be there regarding the studies as well as the other part also, because you have to respond for the all those what are professional related aspects as well as the non-professional. There are so many other things. The human concern should be there between you. So you will learn a lot of adjustment. If you stay in a hostel, definitely. So you'll come to know that you will learn a lot of adjustments you should learn, which are very important in life, rather than subject. Subject is one thing that you are going to learn in the college. Institution will teach you, teachers will teach you. So there are so many other things that you have to take care of that you are going to learn. So which are very, very important to lead a good life as a doctor as well as a good human being. So these are some of the things, expectation from the peer group. So that many things cannot be explained. So you are going to learn in due course of time. That is, so many things have to be learned as time goes on. You learn many things, but this is just a sensitization. That is, what are the expectations? So outside the college, inside the college, in the hostel, okay, in the society, in the other peer group, that is non-medical profession, friends also will have the same peer group will be there. So these are some of the expectations. So they may have from you. So you have to meet up to the expectations from the. You should try at least. So I'm not going to tell you that you'll fulfill all the expectations, but definitely you can try your best. Okay. So to meet up the expectations. So coming to the colleagues. So expectations among colleagues, it's a never-ending topic. So colleagues, so you're going to become a doctor in due course of time. After 5.5 years also, you'll become a graduate. So then he'll obtain your post-graduation degree. Okay. So it's from day one, their responsibility or expectation will start as a colleague. Colleagues will have a lot of responsibility. that you are going to learn during the course of time. So you should first, what I feel personally regarding the expectation among the colleagues, because we are also working since so many years. So what I feel, so what you have to develop is the mutual respect among each other. That is very, very important. Mutual respect among the colleagues in the department, outside the department. So what we call it is interpersonal relationship. There's a definition called as interpersonal relationship. That should be very good. So skills you can learn later. This is very important. So as a human being, so we should learn to respect. So mutual respect should be there among the colleagues. Each specialty, first is among the people, you should have the mutual respect. That's the expectation. And also among each specialty, so you're going to learn, so all of you know the subjects for the first year: anatomy, physiology, biochemistry. So second year subjects will come to know when you enter the college, and so many specialties will be there in a medical profession. Okay, so you should learn to respect each specialty as it is concerned, from anatomy to even if you obtain a specialty, any post-graduation degree, or if you become a super specialist. So every subject has its own importance. So that you should learn. So respecting the among each colleagues, every colleague is very important. You are going to learn one or the other thing from the each colleague. So that mutual respect among the colleagues, that is very, very important. Okay. So one more thing is, so that also to develop a good attitude. So attitude is very, very important to learn anything. Okay, skill can be taught later, subject you can learn later due course of time. But if you develop a good attitude, definitely you will reach some heights. That's very, very important in long term. So I'm not talking about the short term. In long term, that's very, very important. You learn a good attitude. So that's what is expectations among the colleagues. As well as one more thing, professional jealousy should not be there. So that you also try to learn. So professional jealousy is very, very bad. Okay, so that will limit you somewhere. Even if you are very talented, so limitations will start if you develop those kind of things. So try to avoid all those things. So be a good human being, be a good colleague among each other. So try to appreciate the good things, okay, whatever is done from the other department or other colleagues. So it's very important to develop as a good human being, then a good doctor, okay. So that is very important. And never lose hopes in your bad time. So that's also one of the things. So you should never lose hopes in the bad time. Recently we had the COVID pandemic was there. So doctors were worst affected among all this thing. So you should never lose hopes. So because you entered this profession, okay, so that is the expectation the society has from your side. So you should never lose hope. So many ups and downs will come in the profession as well as in personal life. Profession also should never lose hopes when you are in the bad time. So that's the expectation among the colleagues. And never hesitate to take any help from the individual specialties when you are, so when it is concerned specialty, if you want to take help, so do not hesitate taking the help from the any other colleague. It may be your department, it may be some other departments. As a CBME curriculum is concerned, it's a collaborative learning. Okay, so we are learning in the systemic manner, whatever all the subjects collectively we are going to learn. So all are interconnected, from anatomy to whatever the subject, everything is interconnected. So do not hesitate. So this is the among colleagues, these things you can develop. I personally feel it. And you should have a respect for the seniors and also regard for the juniors. Very, very important. Everybody will contribute in one or the other way. So how you treat people, that's how they treat back you. So these are some of the things. So these are the expectations that colleagues will expect from you. So try to develop these things. Definitely, this may be, so like what I'm teaching, you may not be perceptive at this point of time, but definitely you're going to understand this over due course of time when you develop as a doctor or when you practice, okay, throughout your life till death. These things are very important that you should learn. Okay, and also coming to one more aspect which is given to me, that is patience. So this never ending expectation of from doctor, from the patient side. So many expectations they will have. You should try to meet the whatever is concerned, whatever is possible, definitely you should meet it. So you should be polite and develop human concerns. Very, very important. Develop human concerns. And how you treat a patient, how you treat means how you receive a patient is very, very important. So there is a saying that, so when you receive a patient, like half of the way you receive, the way you talk to the patient, so half of it disease will get cured. Okay, so that is very, very important as a doctor. So you should develop those skills of, that is art of talking to the patient and how to treat him and how to elicit a history that you're going to learn here. Okay, they're going to teach you, all our colleagues are with different specialties, they're going to teach you all these aspects. But this is sensitization regarding, so what are the expectations from the patients towards a doctor. Okay, so because you're going to become a doctor, so this is talking to the patient and mannerism and command and language. And command and the language means it need not be English. You should know the local language. You should learn the local language. So if you want to elicit a history, okay, you should learn the local language. You should ask in their language, then only they will be able to tell you the history. English is very important. Even the knowing a local language is also very important. So try to learn. So many of the students are from different parts of the country, I believe. So you should develop learn the local language. Then only we can understand the course of the disease. So whatever if you elicit a good history, your diagnosis will be right. So this is a command over the language as well as a subject. Of course, this is very important. Okay, and also different kinds of patients also you are going to receive, educated, uneducated, so many things. So all those things you should know how to behave with them, how to interact with them, and all those things. And they will have, as I told you, there are lot of expectation as a doctor. So you'll understand in due course of time. That is, what are the expectations? You may be not able to meet everything, but at least definitely you should try your best to meet few things. Okay. So this is in brief about so what is the expectations from the peer group, what is the expectations from the colleagues, and what are the expectations from the patients. So it is, whatever the topics mentioned to us is also like vice versa. So that we have to take this thing from you. That is, what are your expectations regarding colleagues and peer group as well as the patient. So we will wait for your response. And we'll have some questionnaire for you. Okay, thank you.
Dear students, I will ask some questions regarding nations, society, and institutions. So, what is the topic name is expectation of the students. What expect you on nations, society, and institutions? Either you change the nations or any implementations or opinions or any provide to nations or learn from the nations or contribution to the nations. These are the some important points to the nations you expect or you think, and tell me to how your opinions of these nations and society also. So either implement or changes or opinions or contributes to the society. Because you are the doctors, so what you contribute to the societies and institutions also, either cultural or learning, knowledge or educational, uh, and uh, what is your contribution to the institutions? Contributions mainly. So you think about these things or expect to the institutions, and then tell me to the your answers. And then finally give the feedback among the nation, society and institutions.
We are going to summarize. Okay.
ನಾನು ಹಾಪ್ ಮಾಡಲ ಯೋಗೇಶ?
You can type here. Hello, dear students. So, sir has told you already. So, what is the, as a topic suggested is vice versa, expectation of the student and expectation from your side regarding the same, whatever this thing we told you. So, sir told you about the nation, institution and society. So, you can give your feedback regarding the same and same thing. So, what I told you regarding what I discussed is peers, expectation from the colleagues as well as from the whatever the patients. Okay, so I told you a few things. What are the expectation? What do we expect from the you, from a doctor? So what do you expect from the patients? What do you expect from the this thing colleagues? And what are your expectations from the peers? Okay, so you can summarize and give us the feedback. Okay, we are going to summarize it and we are going to submit. Thank you. Okay, you can come. If you want to, whatever you can come up. You can type your expectations. You can, or you can speak. Yeah, yeah. Type. Speak it out. So, request from our side. You can switch off your microphone. Switch on your microphone and switch off the camera, right? Camera, no? Switch on both the microphone and camera, and you can speak out.
Ma'am, we expect the patients to talk about their problems without any hesitation or shyness.
Definitely. If you feel them comfortable, make them comfortable, definitely they will come up with the whatever, they will speak out. So first your duty is to make them comfortable. You learn their language. Okay. You're from which place, ma? Hello.
Bangalore, ma'am.
Yeah. So you make them comfortable. Definitely they'll give a very good history. Okay. So that's very important for me.
And the patient should not take the doctors to be grand.
That you're going to learn in due course of time. Okay, it's at the platform to discuss here. So basically, how we treat them, definitely, at least majority of them will treat us well. That you're going to learn. That we have to learn. We should make them comfortable. Okay.
Ma'am, we want the colleagues to be cooperative and don't be dominative.
Healthy competition. Healthy competition is very important. Competition should be there. Okay. Competition, if it's not there, you cannot achieve anything.
Yes, ma'am.
But it should be a healthy competition. That you should learn. how to make it healthy
Yes,
that
ma'am.
you should learn.
Hmm.
Okay?
Okay, ma'am.
Next.
Ma'am, we should expect the society to follow certain norms to prevent the communicable and also the non-communicable diseases.
Next. Anybody? Yes, yes. ಅಲ್ಲ ಬರ್ಕೊಡ್ಲಿ ಸರ್ ಕೆಲವೊಂದು ಬೇಕಂದ್ರೆ ಸಮರೈಸ್ ಮಾಡ್ತೀನಿ ಬೇಡ ಓಕೆ 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 ಓಕೆ
Ma'am, there should be good coordination between students and the society.
ಕಾನ್ ಇದೆಯಲ್ಲ ಆನ್ ಇದೆಯಲ್ಲ
Ma'am, in case of teamwork, all the members of the team should do the work, like divide the work equally. The burden should not be completely on one person.
Okay. Gaurav is saying he expects government to be in sync with what the healthcare demands. The KPME Act came up as a draconian law, which did not impress many. Okay. That is a statement, doesn't look like an expectation, but that's fine. And Sudarshan Sridhar says not only the patients but the families too has to trust and be cooperative. Okay, that's a fair expectation. Society should support and trust the doctors. Okay, fine, good expectation. We expect the society to believe doctors and have faith in them as well as have trust in them. Same expectation. Patients and society should not have stereotypical thinking that doctors only work for money for their own family's sake. Prashant says that. And Sana says we expect the society to trust on doctors. Family members should not be expected to special treatment in the hospital leaving all patients. Okay, but yeah, Mahalakshmi says family members should not expect special treatment. But in that case, that may be your expectation, but your family has an expectation from you that you give them priority over everybody else. Pankaj Service says expectation from student doctor, they understand the problem without a disease or any other. Solve it very well, communicate with patient person, guide them that how they can prevent and cure the people problem. Okay, patients should have confidence in doctors. Vidya says that. Mohammad Umar, can we talk about the contribution to nation, society and institution? Yeah, that's what is this platform for. We hope you, as students, realize and discuss amongst yourselves about what is that you are expecting from the society at large, the nation, the government, your peers, teachers, your friends, family, everything as you become a doctor, and also what is that you are going to contribute to your family, your peers, your institution, your nation, and every other community, I mean, the community which you live in, how you are going to contribute to that part. There is an open forum where you can actually discuss that, and you are most welcome to actually discuss that on audio. So I suppose all of your friends can hear you. If you speak, they can hear you, and you can discuss amongst yourselves, and that discussion will be recorded here. I mean, it will be broadcast here. So it will be a live interactive session. So go ahead. I invite you to actually unmute your microphones and your cameras. You can go ahead and discuss. All of your friends can actually see you while you do that.
Thank you, sir. Thank you. Yeah. So I have only one expectation that every doctor needs respect in society and from the government. What are all the demands we keep in front of the government? It should be fulfilled. And the main thing is during the contributions. Okay, the main thing is during this pandemic, during the floods, during what we face the problems in our country, during that time we should not think about the money. We should think about how we can serve to the nation. And we have, like, if something happens in North India, like if any flood happens in North India, we have to go there, we have to make a free health camp there, we have to do the treatment to everyone without money, without taking money. And the contribution to the institution, we even if we go out of the institution, we should not forget the institution, because what we will be in the future, it's because of the institution. So we must be interactive with everyone. We should not forget the institution. Then contribution.
I think doctors always work extra hard to save lives, and during crisis they work overtime. So in case they have any needs, any kind of demands for money, the government has to fulfill it. It's not about working free. It's about giving the deserved money for the work done.
No, not. I'm not telling that one. I am telling that during the pandemic, we should not think about the money. During pandemic, like in other cases and all. Okay.
But then the doctors will need some minimum wage to run their family. It's not like they are working 24 hours and they're not getting the deserved amount of, they don't even, if you see the violence against the doctors, they work hard for it, they don't even get the deserved respect or the money. It's not about being money-minded, but it's about
looking for yourself also.
It's not always about the money either. Like, even if it's not the money, if they could just respect us and respect our opinion and our knowledge, it would be more than enough.
That's the main thing. Like,
because nowadays what is happening is, even though the health officers and the doctors are giving so much of attention towards their patients, it is being taken granted. Like, there is no respect over there in the society. That is what we expect from the society, so that they actually know.
I completely oppose that one.
I agree with her. Why would you oppose her? We should be respected. Like, for our knowledge, we do work hard. Even though we don't expect much wages, we work hard and we do some respect. We deserve that.
No, what I am telling is, we have only one expectation, that is respect. And like, respect means what we keep the demands in front of the government. The government should respect our demands and they should accept that one. Like that.
Okay, excuse me.
Yeah.
It's okay to have expectations, but keep this discussion to expectations only. It is not a debate platform. They say your expectations. Somebody else says their expectations. We move on. You understand that, yeah, they have these expectations. It is not a debate forum. Try to just state your expectation and go ahead. Everybody, if they say their expectation, that will be great.
My expectation would, from the society and the patients, would be they should understand the situation of the doctors and not take anything for granted. The knowledge, the work that the doctors do, it's over any. You can really value it. So people should understand the value and the situation that the doctors are in, and they should be considerate of it.
Okay.
I agree with her completely.
Yeah, fine. Next.
Another expectation from me is that there are certain fields in medicine that is not talked about openly from the patient side, like whether it is an STD or terminal illness and all such diseases and all. If a patient is getting those patients are very shy towards the doctors to open up, to trust them and all. So I expect the patients to trust us and not be shy about certain diseases.
Okay, fair. Next. Yeah, go ahead. Whoever wants to add anything, share their expectations or what, not only their expectations, and they can also share some ideas about what the nation expects from them.
Yeah. So the patients must not get carried away what's written online and must not believe whatever is given online and cross-question what the doctor already knows and has the experience on. Because the problem happening is now everything's available online, even the smallest treatments. They look through that and they start comparing it to what doctor has done from practice and got results. Rather, they just trust what is given online and which is not very sure and authentic. So patients come with a fixed mindset that they need to be treated in such a way or they should be looked up in such a way. So I guess we expect as going to be doctors that the patients must understand us and must trust our knowledge because we've done it practically once and it's their first time.
Yeah, right.
ನೀವು ಅದನ್ನ ಮಾಡರೇಟ್ ಮಾಡಬೇಕು, ನಾನು ಅದನ್ನ ತರಿಸ್ತೀನಿ. Let us ask. Can I ask someone to actually say their views about what the nation expects from them or what the institution expects from them, what their peers would expect from them? What is your idea about this?
Good morning, sir.
Yeah, Arun, you can tell, no?
No, carry on, later.
Okay, I feel like the society expects us to be humble doctors who are service-oriented people and who are ready to help the society and put the society before ourselves.
Yeah, I totally agree with you.
Basically, what happens now, institution of the nation expects from us is we should have a great practical knowledge rather than having only theoretical knowledge. So then only we will be called as a good doctor when we have some practical knowledge just by attending some patients while we study itself. So the nation, what expects means we should be a good doctors, not only thinking about the money. Yes, money is important, but it should not be the primarily priority for us. So that's it.
Yeah, exactly.
That's excellent. What I would add to that is that is what the current curriculum is encouraging you to become more practically sound and experienced doctors by the time you become doctors and start practicing. So that is the goal of the new foundation course as well as the entire change in the curriculum. This is the second year. You will be the second batch undergoing the CGM. So I'm happy about that.
Yes, sir, we are very grateful for having this opportunity of having a new curriculum which has more analytical skills and cross questions and interactive sessions.
Anybody else?
Also, also one more thing, we see that patients normally, if you compare our system to an abroad system, all of their health records, everything are all linked together, and they have it in a place like in a particular capsule kind of thing, or whatever as documents, because all of them are insured, and everything is in sync for them. But what happens here is you don't have patients expect that in the future, if anything could be done, just like how the health card which is going to come right now, so that every detail of our thing is linked, so that whenever they visit a hospital or something, they can show to the doctor. At least the doctor can diagnose from the past history that he had this or not, because many of the patients won't tell they have got treated here or what happened to them before. So I guess that's a change we need, so that it becomes a better relation between patient and doctor, rather than
Yes, definitely.
Yeah, good point. Hopefully, we will also have electronic medical records implemented throughout the country, which would probably help practice. Good point. Next.
ಸರ್ ನೀವೇ ಆನ್ಸರ್ ಮಾಡೋದ್ರೆ ಮಾಡಿ 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 ಸರ್ ಮಾಡೋದಂತ ಮಾಡಿ ಸರ್. ಅಲ್ಲ ಹೇಳಿ ಸರ್, ಏನಾದ್ರು ಮಾತಾಡಿದ್ರೆ ಮಾತಾಡಿ ಅಲ್ವಾ? ಅಲ್ಲ ಇಷ್ಟು ವಾಂಟ್ ನೀವು ಏನಾದ್ರು ಇರುತ್ತೆ ಹೇಳಿ.
Excuse me. Can I
Go ahead. Go ahead.
Basically, in colleges, we'll be having some friendship groups like that. Yes, no. In that group, we can invest the money. Where basically, we'll be investing for nonsense things. So we can use those money for better camps and free treatment for poor children like that. So I think that is what the nation expects from us as a doctors. But basically, as a student, the nation expects that from us. I think so.
Good. Wonderful. Keep doing it. Anybody else?
There are different lines of medicine such as Ayush, homeopathy and allopathy. So the society must integrate with all the different fields of medicine, and there must be a coordination between Ayush, allopathic medicine. They must not have misconception that allopathy harms us and Ayurveda is more better.
I disagree, because see, the medicine what we are learning allopathy is evidence-based medicine, and what is homeopathy? It's completely different. Their practice different. You probably cannot integrate it. Both are separate. This thing itself. I mean, by integrating, there'll be conflict of interest between both ideas. They'll think that no, we should do it in this way itself. We think no, we study in this way. Our knowledge is this way. So nothing won't merge. There's no common meeting point between both.
Yeah, I literally agree with Gaurav, bro.
Yeah. What I would add is there is nothing called as allopathy. There is evidence-based medicine, and everything else is not evidence-based. So you are in the stream of evidence-based medicine. Try to stick to evidence-based medicine. Anybody else?
We have to do camps in rural areas so that all the people will get the health checkup freely.
Okay, anybody else?
Among medicos, there should not be a mindset saying that you do something first, then we will follow you. if anybody has ideas about a certain topic or about a certain event, they should come forward and tell it instead of waiting for somebody else to join them or waiting for somebody to do first.
Great point. That is why we have research which gets published in the international journals, which everybody can access.
ಅಷ್ಟೇ ಬರೋದ್ರಲ್ಲಿ
Excuse me, sir. I wanted to tell what the institution expects basically from us. So the institutions doesn't expect us to be good doctors, but the institution mainly wants us to be not tagged as a bad doctors. We should not be tagged as a bad doctors, and they should not point us by saying that he has come from this Basaveshwara Medical College and he became a bad doctor and is treating his patients very badly. We should not be like that. At least we should not be good doctors, but we should not be named as a bad doctor as well. That is mainly important. Thank you.
Being good doctors is a better thing. That is a better aspiration. So be good doctors, but
yeah, definitely, but bad doctor is not so
doctor
good.
from Basaveshwara Medical College and Hospital.
Yeah, if we are considered as good doctors from Basaveshwara Medical College, it's too okay. But we should basic thing is we should not be named as bad doctors. That is primary, right?
No. That question does not arise. Don't worry.
Okay, ma'am.
Any other expectations from your side? Any other discussions? Any other expectations, students, from the discussions? You're welcome.
I feel like what I expect from the government is like they should invest more on the healthcare systems, especially in economically weaker areas like in the villages and all. The healthcare systems have to improve, like because most of them will not be able to afford private healthcare rates. So I feel like they have to invest more and they have to plan it better so that hospitals are there in very strategic places where everyone can access, like all the poor people can access them, and good quality healthcare is provided to them also.
Definitely, you are right. Healthcare is one rare to significant healthcare system. So it's going on, I believe. Started going. We have to wait for some more time. Definitely, we have to invest more on the definitely. You are right. We will recommend. You can also contribute as a doctor in future. Right? Yes, any other expectations, any queries, any other discussions, discussions?
ಈಗ 100 ಸ್ಟೂಡೆಂಟ್ ಇಲ್ವಾ ನಿಲ್ಲೂ ಅಡ್ಮಿಷನ್ ಆಗುತ್ತೆ ಪಾಪರು ಅದೇ ನೆಗೆಟಿವ್ ಎಲ್ಲ ಅದಿರಲ್ಲ ಪ್ರಾಬ್ಲಮ್
hello sir.
ಒಳ್ಳೆ ರೆಸ್ಪಾನ್ಸ್ ಅಲ್ವಾ
Excuse me.
ತೀರಾ ಆನ್ಲೈನ್
Hello, sir.
ಜನ ಬರ್ತಾರೆ ಅಂದ್ರೆ ಥಿಯರಿ ಕ್ಲಾಸ್ಗೆ ಬರ್ತಿರ್ಲಿಲ್ಲ
Yogesh sir.
ಏನ್ ಹೇಳೋದು
Hello.
ಇದು ಹಾಫ್ ಆಗಿರ್ಬೇಕು
Sir ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
ಸ್ಟೂಡೆಂಟ್ಸ್
Hello. Sir ಕೇಳಿಸ್ತಾ ಇದೆಯಾ?
See what nations, so your contribution to the nations after become doctors, or what you expect the nation from now onwards, because you are joining the medical course, no? So nation maybe provide this medical colleges, the giving all the facilities, including teachers, everything, no? That's why either you expect from nations, or so you contribute to the nation. This is one point to discuss with. And society also. So you know you all belong to the society, living in the society only. Either so different varieties of culture, language, religions peoples are present in society. So how you either contribute to the society, or how you expect from the societies. So another institute, suppose your Basheshwara Medical College came to here, either how to see foundation course mainly is very important for the changing of the attitudes, behavior and culture. So because here totally they modified of your cultural, because that's why they started foundation course. Before after entering, they all it's possible to expose to the clinical side, or attitudes, behavior, or relationship of the teachers and students also. So these things very important for you, and so you either after the coming to the institute, either private institute or government institute, no difference. So here all medical colleges same, the same department, either anatomy, or physiology, or biochemistry, or microbiology, forensic, everything same, and faculty also. But some institutes are very good, some institutes are not good, depending on these facilities. But okay, they, especially our Basheshwara Medical College, they giving a very good opportunity and provide the facilities also. So you know the 3-4 years they coming here to 100% result also, first year, second year, like that. And here good atmosphere to either facilities, either hostel or college or the hospital facilities. So after it's a mainly foundation course, so changing of environment of your lifestyles, this is one important. I'm asking just only the contribution to either from you expect from nation, or you contribute to the nation, or you expect from society, or contribution to the society, like that you discuss of this only, and then the madam told these colleagues, patients, peers, like that only. These are some important points of the today these topics of
Excuse me, sir. Am I audible? So can you hear me? Hello.
Yeah, you are audible.
Yeah, no, I just wanted to say something before the class ends. So we're all talking about like like what the institution expects from us, or like what the nation expects from us, and all that. So I just want to say, like, I don't know, I feel like it's important, like what you expect from this, right? Rather than thinking about, yeah, I expect this from the nation, or like, yeah, the institution expects this from me. So I'll just finish this 1 second. So like, I just want to say, like,
So, okay, sure. If you ask me what I expected from this, I just want to learn anything or everything I could learn to help the person who's in need. And that's all I really expect from this. I just wanted to say that. That's all.
Hello. Idara? Hello. Yeah. Dear students. So it was a very good interaction from your side, from all of you. So we had some queries regarding, we had some distinct doubts regarding so many fields. Okay. So first come to the institution. So we can be sure of becoming a good doctor. So it will meet up to your expectations. When you enter the institute, you'll understand. So definitely you're going to learn in a better way and you're going to become good doctors. And from regarding our expectations point of view, we had so many expectations regarding from the nation, okay, society, as the colleagues. We had very good queries. We answered many of them, I feel, in a satisfactory way. So it was a good discussion. So always expectation should not be from one side, okay. So both the sides we should try from the society as well as from your point of view, okay. So then only expectations will be fulfilled. So we should try to contribute in that way. So you'll understand later, but just I'm telling you. So even the society expects, the nation expects few things from you, you can also expect many things from the nation. So always it should be a mutual understanding. Okay. So any other things you can definitely interact regarding this. So till now we had very good interactions, very good questions, very good these things from student side we got. Okay, we got to know. So it was a good interaction from the student side as well.
Feedback
Okay, thank you. Thank you.
If you wish to carry on the discussion, you can go ahead. Otherwise, we can end this session. The feedback form link will be posted in Google Classroom at 11:45, and you guys need to fill the feedback form and let us know what you thought about this particular session. It is actually divided into 2 hour each sessions, but since it's an interactive session, it got over a little early. You guys can carry on if you're done with the session, or if you want to continue interacting with your friends, your batchmates, you can continue to do that. I'm sorry, I could not read all the expectations that were typed in the chat box. It's unfortunate, but we wanted to make it as audio based as possible because everybody then could hear it. The chat is not the suitable medium. Sana, sorry for that, but we'll try to read that as well. Yeah, the point is you have to interact with your peers and everybody has to know what your point of view is, not just the professors. Your batchmates need to know that. So it's good that you have typed it in the chat box and your friends have read it. So keep it up. We have read most of the charts that you have actually posted. We tried to read them out initially, but it's not possible to read every one of them. If you have something to say and if you want to make a point, please go ahead and make that point on the mic. Switch on your mic and say it out loud so that everybody can hear it, not just read it. Okay, Sana, you can do that if you are interested in sharing your idea.